is that if you look at India, we will have to look at a division focusing on urban, semi-urban, and rural, and each one's needs may be quite different from the other. While the urban might have more of a specialty and super specialty need, I don't think that that will be so much of a need, definitely not in the rural area. Um, so this could be something that the UK Council could, maybe consider. But regardless of whichever category, my thought is that we could use nursing much more than we're actually using them. And even in the urban area, I think that my thought is that if we could empower nursing much more, they would take the load away from the doctors to a large extent. And when I say empower, our nurses don't feel very strong and confident in the face of a doctor. They might feel confident in the face of a patient, but not so much in, along with a doctor. So I think if they were empowered more, they would actually be able to do a much bigger job. I'm not saying better, but a much bigger job than what they're doing now. I think we definitely need much more help in the area of home nursing so that many of our patients who don't need to be in hospitals, like you mentioned, can be better taken care of at home. But it's very difficult for us in big cities, or I'm sure even more in small, to find anybody for home nursing. And you don't need to have a nurse with a 3.5, 4-year training program for that. We really need a category of patient educators, and I don't think that in India we have that category. So somebody who's not necessarily a nurse and who's definitely not a doctor, but is just a patient educator. I think we need a category of patient educators who could get maybe a couple of years of training after schooling and could really be of great assistance to the patient. Somebody who's not a graduate in pharmacy, in pharma, but can be, work in pharmacies, etc. I think perhaps that could be a big need. Non-communicable diseases is very big, and I think we should have a category certified as life coaches. We don't have that category. We've tried in India, but we don't have a certification for them. So if you go to a semi-urban area and a doctor wants to tell somebody what to eat and how to work out, post an MI, we don't have a category of people available to do that, even in urban sections. So I think a category of life coaches. I also think somebody in a certification area, because there's so many new clinics, new hospitals, etc., that are coming up. So I think even a category that can keep moving around and certifying that yes, the people that you're using or the services and the equipment that you're using does kind of go along with certain minimum standards and so on. So